Welcome back to Sunrise. Measles cases are continuing to climb in the U.S.
The number of cases is nearing the total number confirmed last year. As of June 26th, there are 2,134 cases in this country. Throughout all of 2025, the CDC said there were almost 2,300 cases. And around here, 90 in Virginia, 1 in the district, 4 in Maryland. And one of the people watching this closely is Dr. Anahita Dua, surgeon and founder and chair of Healthcare for Action. So good to have you back. Thanks a lot.
Thank you. It's a pleasure to be here.
Yeah, we've spoken about this measles issue before, and, this is another reminder that measles is not being controlled because so many people are not vaccinated. Talk about what this means and how far you think this number of cases can go.
Absolutely. The issue, of course, is that this number of cases can rise dramatically. We've seen it historically, hundreds of years ago, essentially. And since basically 100 years ago, we've never seen an outbreak like this. So it really is telling us that what we heard previously was kind of a false narrative, that if you don't get vaccinated, nothing happens. Because what we seem to forget sometimes is it's not just amongst us, but there's a lot of international travel that also happens these days. There are people that come from other countries. And in fact, just recently at 2 big airports in Chicago and in Arizona, there were cases reported where someone ended up in the international terminal, and had somebody been unvaccinated and been near that person, they would have caught it, brought it home, and spread it. So it's a real danger, because measles can harbor in the body before you show symptoms for up to 21 days. And as you can already see, over the last 2 years, we've had a dramatic increase across our country.
And Dr. Dua, how serious of an illness, we're talking about all these increased cases, how are these patients faring?
That's the perfect question. Badly. If you catch measles, bad things happen to you. To break it down specifically, what happens that can be really terrible, especially in children, is something called encephalitis, where the outer lining of your brain actually swells. You can get horrible situations where you end up in the ICU with seizures, ultimately dying from this type of disease. And the saddest thing about it, of course, is the death, but the biggest problem is that it's so preventable. So it's not something that's a small or no big deal. If you catch this, it doesn't just go away ultimately. And that is why rates of vaccination are so important, because the beauty of it is, if you're vaccinated, then the chances of you catching measles, even if exposed to someone contagious, is very low.
Dr. Dua, for parents who've chosen not to get their children vaccinated, what is your advice to them?
My advice to them is to say, take your kid in to get vaccinated. There are no ifs, ands, or buts about it. This is a matter of protecting your child. In the same way that you wouldn't let them walk away with a stranger, in the same way that you wouldn't let them touch fire, you should let them get this vaccination to protect them. Because remember, again, it's not just about them. While vaccination itself is a highly protective thing, the real reason that we as Americans have been so safe from this disease for so long is something called herd immunity, where if everybody is vaccinated at least to around the 94 to 95% level, then people are protected across the board. Our numbers have already dropped down into the early 90s, 91, 92%, which may not seem like a big deal, but when you convert that to the thousands of people who are not being vaccinated, that is a big deal. And once that herd immunity drops, now suddenly everyone is at risk. And not just others around you, but you and your child specifically. So my advice would be, get them vaccinated. There's no shame in it. Even RFK has said, this is the one disease you should get vaccinated against.
Well, RFK, you say he's talking about getting vaccinated for this disease, but he has been a skeptic of vaccines in the past. And I wonder, what do you think the cause of this decrease in the tendency to get vaccinated is? Is it, social media where messages about skepticism over vaccines kind of proliferate, or is this a federal government issue?
I think it's both. Unfortunately, we had very mixed messaging over the last year, complete confusion about what was right and wrong and what vaccinations really meant. And the problem is, when you have a situation like that, people start to question, right? They start to question what is true. And so indeed, we had a slew of people that were not vaccinated, And we had people believing some of that misinformation, including RFK himself, who again, as I mentioned, backtracked because once he realized, oh man, this is really a problem, we started to see him say, actually, no, you should get vaccinated. And that misinformation comes with lives. It's not about the numbers. It's not about these statistics that I'm throwing out. It's actually about children and the pictures of those children in the ICU dying with feeding tubes in their nose, with seizures, and even those who luckily survive never being quite right again because they had this brain inflammation.
Well, there's more evidence that the administration supports the idea of vaccines because after saying service members don't have to be vaccinated, service members now have to be vaccinated for a flu outbreak that has slammed the 37th Training Wing at Lackland Air Force Base. Can you briefly talk about this? We've got about a minute.
Absolutely. So this is another example of total misinformation. Basically, Pete Hegseth had said that we don't need to give vaccines to people. We don't need to force them in that situation because that's not something that really matters. But we know that the rate of vaccination for flu is about 40% in the general public. So we knew that that's what it was going to be at these Air Force bases as well. And indeed, that's what happened. And dropping down to 40% when you're in close quarters, when you're in demanding physical situations, will result in flu spreading like crazy. And that is exactly what happened. Almost 300 cases. And that's why they immediately had to reinstate people getting the flu vaccine.
All righty, Dr. Anahita Dua, surgeon and founder, chair of Healthcare for Action. Always good to have you on and get such good information. Thank you.
Thank you.
Thank you.
All right, over now.